Hey everyone, welcome back to my channel Mariko's Guide. This is Dr. Ida Khan, and today in this final part of the series, we'll take a closer look at postural reflexes and stereotypies. So let's get started. Now here are the examples of postural reflexes: stepping reflex, crawling reflex, swimming, head and body righting reflex, parachuting, labyrinthine, and pull-up reflexes. Now let's discuss them one by one. Okay, so the first reflex is a stepping reflex. Now, here the stimulus would be if the infant is brought in an upright position with the feet touching surface, then the response of the infant would be lifting and descending of legs. And duration is from after birth to 5 to 6 months, and it is essential for runner to walking. Sometimes this reflex is also referred to as walking reflex, and over time, some developmental changes also occur in this reflex so that it can make a successful transition into walk. Now the next one is crawling reflex. Now if the infant is placed in a prone position on surface and there is stroking of alternate feet, this results in a crawling action of legs and arms. Duration is from birth to 3 to 4 months, and this is a precursor to later voluntary creeping. Now swimming reflex. When the infant is held horizontally, this results in a coordinated swimming type action of legs and arms. Duration is from 2 weeks after birth to 5 months. And an interesting fact about it is that infant swim programs became popular with the recognition of this reflex. Now, next reflex we have is head and body righting reflex. Here, the infant is placed in supine position, and when the body is turned in either direction, head rights itself with the body. While if the head is turned in either direction, body rights itself with the head. Now, duration for the head lasts from 1 to 6 months, while for the body it lasts from 5 months to 1 year. And this is related to voluntary rolling movements. Now we have parachute reflex. So here there is off balance in upright position, and as a response there is protective movement in direction of fall. So duration is from 4 months to 1 year, and this is assessed in preterm babies as markers of neurological development, and this is related to upright posture. And this reflex is also referred to as propping reflex. This can occur in downward, sideways, and backward direction. Now, the next reflex that we have is labyrinthine reflex. When the baby is held upright and tilted in one direction, then the head of the baby, as a response, tilts in opposite direction. Now, duration is from 2 to 3 months to 1 year, and this is related to upright posture. It is also considered as a primitive reflex. Okay, now the last reflex is pull-up reflex. Now here this can be performed in sitting or in standing position. Hands are held and the baby is tipped in one direction. As a response, arms would flex or extend in order to maintain the upright position. Its duration is from 3 months to 1 year, and it is related to upright posture. Now let's take a look into stereotypies. Reflexes are most studied form of human movement during first few months, while stereotypies are another form of movement observable during infancy. These are characterized by patterned, stereotyped, highly intrinsic, and involuntary movements of the body. These movements are involuntary and typically last for seconds to minutes. They appear multiple times a day and are associated with periods of engrossment, excitement, stress, fatigue, and boredom. And these are rhythmic, fixed movements that are predictable in pattern and location on the body but seem to have no purpose. Now, characteristics of motor stereotypies. These are involuntary movements, they have predictable pattern and location, they last for seconds to minutes, they appear multiple times a day, they are associated with stress, excitement, or boredom, and they are stopped when distracted. So, these characteristics can help diagnose motor stereotypies, and distraction can be a useful tool in managing symptoms. Types of motor stereotypies. Stereotypies are subdivided into two groups: primary and secondary, depending on the existence of other behavioral or neurological findings. Primary motor stereotypies occur in children who are otherwise developing normally, and this can be a source of concern for parents. While secondary motor stereotypies occur in children with developmental conditions, for example, autism, intellectual disability, etc., and these are often associated with underlying neurological or developmental disorders. Now let's talk about some major types of motor stereotypies. which are common motor stereotypies and complex motor stereotypies. So the first one we are going to discuss about is common motor stereotypies. These behaviors typically resolve in childhood, but some may persist into young adulthood. Some common motor stereotypies may overlap with habits in children. Now, let's take a look at some instances of common motor stereotypies, and these are thumb sucking, nail or lip biting, hair twirling, body rocking, self biting, teeth clenching or grinding, and head banging. Now, the next one is complex motor stereotypies. They often appear in the first 3 years of a child's life and persist. Movements are often accompanied by mouth opening or head posturing. Examples include head or arm flapping or waving, wiggling fingers in front of the face, rotating or opening and closing the hands, and finger wiggling. Now, causes and treatment. For the primary motor stereotypies, causes are unknown, and treatment includes behavioral therapy, parent administered behavioral therapy with therapist support, and instructional DVD based home therapy. Now, according to Lowry, stereotypical movements are a natural and essential part of a healthy child's development. These movements may help infants release tension and anxiety, promoting relaxation. Stereotypical movements may lay the groundwork for future voluntary movements, helping infants develop motor skills. On the other hand, Thielen argues that stereotypical movements have no specific purpose or function. According to Thielen, these movements are not regulated by the nervous system, suggesting that they might be more reflexive in nature. Thielen observed that infants dedicate a significant amount of time to stereotypical movements, with a peak between 24 to 42 weeks. Thielen categorized stereotypical movements by the body region involved, including legs and feet, hands and arms, fingers, torso, and head and face. Now, what are some common stereotypies? These are single leg kick, two leg kick, alternate leg kick, arm wave with object, and finger flexion. Alright, now let's get to its conclusion. Motor stereotypies are rhythmic, fixed movements that can be primary or secondary. Treatment options include behavioral therapy and parent administered therapy. Accurate diagnosis and management can help alleviate symptoms and improve quality of life. And further research is needed to understand the causes and optimal treatment approaches for motor stereotypies. And that's a wrap. I hope you now have a better understanding of infant reflexes and stereotypies. Remember, reflexes play a crucial role in your baby's survival and development, and by supporting their reflexes, you can help them thrive. Thanks for watching, and don't forget to like, share, and subscribe for more such informative videos. Until then, take care.